Hey guys, what's up? My name is Memo Cano. Welcome to MC Productions. Today we're going to be teaching you all a little bit about some STDs like last week. Now these are obviously covered extensively in medical school and they're very common. Make sure you ask the sexual history in your physical exams and interviews. Very, very necessary. But so, like I said, today we're going to do STDs. Today's topic is gonorrhea. And so I'm going to jump right into it if y'all don't mind. So, this is a gram-negative diplococci. And these are intracellular, so you might not see them on the slide, but they're going to probably be inside of the white blood cells. PMNs, kind of like chlamydia, I believe. So in women, it affects the full genital tract. For men, it's usually limited to the urethra. And on history and physical exam, you're going to notice those symptoms. You're going to be able to see it. For example, in women, you're going to find a green-yellow discharge. You'll find pelvic or adnexal pain. And swollen Bartholin glands are a possibility on physical exam. And for males, you're going to have purulent urethral discharge, urethral erythema, so this is still just the urethra, and you're going to have dysuria. What is dysuria? Painful urination. It's just a fancy word for it hurts when I pee. Okay, so some things you want to think about in your differential diagnosis when you're considering gonorrhea is chlamydia. They work very close, hand in hand, and you have to have a low threshold of suspicion for a co-infection, right? Another thing you're going to want to rule out is endometriosis in women. Pharyngitis, I guess it affects the pharynx as well. That's crazy. PID, pelvic inflammatory disease, and like we talked about last week, PID is going to cause all kind of complications like infertility and ectopic pregnancy. So you really want to make sure it gets treated before the complications occur. Next, vaginitis. Just a simple vaginitis, irritation, and just inflammation of the vagina, right? That's what vaginitis is. So anything that causes vaginitis, that's on the differential diagnosis for this. UTI, of course, dysuria. Any UTI is going to cause dysuria. So just because a patient comes in with signs and symptoms of gonorrhea doesn't mean it's not UTI, or just because they come in with symptoms of UTI doesn't mean it's not gonorrhea. That's why the sexual history is very important to help rule out those nasty bugs that can cause PID, Fitzhugh-Curtis, infertility, Reiter syndrome, and a couple other complications that we'll go over in this video. Another thing you're thinking about is salpingitis. Anything that causes the what are they called, the tubes, man, it's slipping my mind. Anyway, salpingitis is the tubes, swelling of the tubes. You know when they say the tubes get tied, I just can't think of the word right now. Salpinx. And a tubal ovarian abscess can also cause kind of feel the adnexal pain. Anything that causes adnexal pain is going to be on the differential diagnosis. And so for diagnosis, this is how you diagnose. The gold standard, which is the most important thing. The most important thing, because the gold standard is going to give you it's the answer, really. And it's a gram stain in culture and nucleic acid amplification test. And treatment for gonorrhea, you want to do ceftriaxone intramuscular and azithromycin orally. Now you want to make sure you use 2 agents due to rising rates of resistance. So for disseminated disease, you want to use IV ceftriaxone for 24 hours. to really get that disease taken care of, that infection taken care of, you want to make sure that if possible, you treat all sexual partners as well. And like in chlamydia, one of the risk factors are lack of protection, sexual protection, and multiple sexual partners. So if there's sexual partners, you want to ask how many they have. Are you able to contact them? And that way you can get them, that way you can eradicate the disease. So condoms can be used as prophylaxis. They're very effective as prophylaxis. You want to make sure you're using prophylaxis if, well, I'm not going to get into that, but so complications, somewhat similar to chlamydia. Infertility, PID can lead to infertility. Ectopic pregnancies, you want to avoid that altogether. Tubal ovarian abscess, again, that's a complication of gonorrhea. Migratory polyarthralgias, so painful joints that move, migratory move. Tenosynovitis, inflammation of the synoviums, and pustular skin rashes. Alright guys, so that was gonorrhea. We did chlamydia last week. Let's see what we get next week. But if y'all learned anything, or if y'all enjoyed the video, please like and subscribe. And if you have any suggestions or comments, comment down below and let me know. Peace.